Hi, and welcome to the fourth installation of the Pelvic Empowerment Overactive Bladder series. I'm Tori, and I am a doctor of physical therapy who specializes in pelvic dysfunction, which means I treat things that can go wrong around the pelvis, and this includes bladder dysfunction. If you haven't, please do check out the previous 3 videos in this series, as these videos are much more effective if viewed in order. And this video assumes that you've kept a bladder diary, reviewed it with me, identified which bladder retraining strategies are going to be the best for you, and that you're ready to learn some urge suppression techniques in order to better support some of those retraining strategies. So in today's video, we will first discuss my 4 favorite urge suppression techniques and why they work. We'll then talk about how to use them as bladder retraining strategies in isolation, and finally, how to pair them with other bladder retraining strategies. As always, timestamps and links to any studies or resources mentioned today can be found in the description below, and without further ado, let's get into it. As you may recall from the first and second video in this series, when you feel urgency, what you're actually feeling is the walls of the bladder contracting. So urge suppression techniques are all aimed at helping that bladder muscle relax, at stopping those contractions in order to suppress urges. My personal favorite urge suppression technique is to perform 4 or 5 strong pelvic floor contractions or Kegels in a row. Not an endurance hold, not contracting and holding the pelvic floor, but instead 4 or 5 very well defined contract, relax, contract, relax Kegels in a row when you feel urgent in order to relax the bladder and suppress that urge. But why does this work? How does this technique actually help the bladder to relax? Well, the bladder and pelvic floor actually have an inverse relationship. While it may be counterintuitive at first, if you can imagine your bladder living on top of your urethra and your pelvic floor acting as a sphincter around your urethra, you may be able to imagine that when you urinate, ideally, your bladder is contracting to squeeze out your urine, but your pelvic floor is relaxing to open that urethral sphincter. There's a reflexive inverse relationship here, where a relaxed pelvic floor tells the bladder to contract. When you do the opposite, when you contract your pelvic floor, you can tell the bladder to relax, which can suppress urgency. Another urge suppression technique is to apply external pressure to your saddle area. Have you ever seen a little kid who really needs to pee instinctively hold their saddle? That instinct occurs because applying that external pressure to the pelvic floor can also send a message to the bladder to relax and therefore suppress an urge. Of course, depending on where you are, it isn't always appropriate to use your hands to place external pressure on your saddle, so you can always try sitting down, crossing your legs, or even sitting on your hand, depending on where you are. A third technique is to implement a sort of relaxation strategy. Urgency is a very sympathetic fight or flight, I've got to go right now, it's an emergency kind of response. If you can relax your breathing, your body, and your mind, you can sometimes trigger a relaxation response in your bladder. I personally lean towards breathing relaxation techniques in the clinic, first pausing to ask yourself, am I holding my breath? And if you are holding your breath, asking yourself, okay, can I allow myself to just calmly and gently exhale? And then once you've started breathing again, maybe you could try a 4x4 breath, where you inhale for 4 seconds. You're going to hold that at the top for 4. Then you're going to exhale for 4. And you're going to hold here at the bottom for 4. and then you repeat that 4 times. Of course, you don't have to use the 4x4 breath or any breathing related relaxation technique really. Any relaxation method that you know works well or resonates well with you is worth trialing. And finally, a 4th urge suppression technique is distraction. I think we've all experienced at least once in our life having an urge to urinate, having to pee, getting distracted, and then when we weren't paying attention, the urge went away. There are a lot of different distraction techniques that you can try. I'm a big fan of really difficult mental math problems, like picking a bizarre number like 93 and then counting down by an odd factor like 7, something like 93, 86, 79, 72, and on down. You can also try focusing on a different body part and trying to do something that is mentally challenging, like rolling your ankle to the right, but trying to draw a circle in the air to the left with your finger. And I've even had some patients report success by implementing sort of conversations with their bladder, like hey bladder, thanks for this message, but I'm busy working on X, Y, and Z right now, and I'm problem solving, and I'm using this in order to find a solution, and just giving your bladder a whole bunch of detail about whatever it is that you're doing until you get distracted and the urge dissipates. The thing with distraction or any urge suppression technique is that you're going to have to allow yourself to have a trial and error period where you figure out which urge suppression technique or techniques work the best for you and your unique body. I always recommend picking one of the techniques and trialing that technique for at least a day when you're at home and it's safe and okay if you have an accident. Go through each of the different options for at least a day or two and figure out which one or ones work the best for you. Once you've identified which technique or techniques are the most effective, it's time to use them as bladder retraining strategies in isolation, pair them with other bladder retraining strategies, or both. Regardless of whether or not you'll be pairing the urge suppression techniques with other bladder retraining strategies, it is incredibly important to use the urge suppression techniques in order to retrain your behavior on the way to the toilet. A lot of times with urgency frequency, because it is such a sympathetic fight or flight emergency-esque kind of event, someone will run to the bathroom, undress along the way, and even start peeing before they're comfortably seated or standing by the toilet. I highly recommend retraining that response so that your brain and bladder both learn that toileting is not an emergency and you can regain your control back over that event. Instead of running to the toilet and undressing along the way, use whatever urge suppression technique works the best for you to gift yourself a window of time where you can start practicing walking slowly and calmly to the toilet, not undressing until you're actually in the bathroom, and you don't start peeing until you are comfortably seated in the proper position on the toilet or standing in the proper position by the toilet. We will discuss proper toilet positioning in the next and final video in this series. If you are someone who experiences leakage, who experiences urge incontinence, I do want you to know that that might get worse before it gets better during your retraining. As frustrating as that might be, it's okay. And as counterintuitive as it might seem, it's actually better to leak while walking slowly and calmly to the toilet than it is to barely make it after running to the toilet and undressing along the way. The latter reinforces the brain's sympathetic fight or flight emergency-esque response to having an urge to urinate, and we can't retrain that response if we don't break the cycle. Finally, urge suppression techniques are a practice and they affect different people differently. Some of us will implement them and they'll suppress an urge for 15 minutes right off the bat, and others will implement them and they'll only suppress an urge for 15 seconds, and that's okay. Keep practicing, trust that it'll improve over time, and do your best there's nothing more that you could do. Also, using urge suppression techniques to recognize what is a true urge instead of a trained urge secondary to poor bladder habits is also a practice. When you implement an urge suppression technique, take a moment to reason through whether or not this is an urge that you should act upon. Did you recently consume a bladder irritant? When's the last time you peed? Are you experiencing a true urge, or is this just a habit that you formed? And if you're not sure, that's okay. That's part of it. Use the urge suppression technique to buy yourself some time so that you can walk slowly and calmly to the bathroom. Don't undress until you're actually in the bathroom. Sit on the toilet properly to pee and then start peeing. With practice, you will be able to learn the difference between a true urge and a habitual urge. All right, in the previous video in this series, we discussed identifying just in case peeing habits as well as activity triggers. And I mentioned that urge suppression techniques and proper behavior surrounding toileting would both be really helpful strategies to help kick these habits and retrain your bladder. With just in case peeing, having one or more urge suppression techniques in your toolbox that you know can help you suppress an urge should you have one makes kicking the habit so much easier. Because now you're not only aware of when and why you're just in case peeing, but you also have a strategy that you know works that you can use to suppress an urge. So you no longer have to pee just in case that urge might arise, because if it does, you can implement your urge suppression technique, buy yourself some time, and walk slowly and calmly to the bathroom. When it comes to activity triggers, urge suppression techniques are immensely helpful because now you're not only aware of what might trigger you, but you also have a technique that you can implement so that you can suppress the urge and evaluate whether or not you need to actually act on it. For example, if your trigger is classic key in the door urgency, where you've just gotten home and you're unlocking your front door in order to enter into your house and you get this really strong urge to urinate, you can use an urge suppression technique, suppress the urge, and give yourself a moment to evaluate. Did I just drink a bunch of coffee or have some other bladder irritant that would cause a really strong urge to urinate? When's the last time that I peed? Does it make sense that I'd have a cup or two of urine in my bladder right now? Is this a real urge that I should act on, or is this just a habit that I've formed? And again, if you're not sure, that's okay. That's part of it. Just use the urge suppression technique in order to give you a window of time so that you can walk slowly and calmly to the bathroom. Don't undress until you're actually in the bathroom. Assume the proper toilet positioning for urination and then start peeing. Finally, if you are someone who implements all of the bladder retraining strategies that we've discussed thus far with little to no success after 2 to 3 months, you might benefit from pairing those strategies with a much more regimented bladder retraining program where you pee on timed intervals regardless of whether or not you actually have to urinate, and you use the urge suppression techniques in order to meet those intervals. Usually this strategy is warranted when someone has more severe urgency frequency, like maybe they're peeing every 15 to 20 minutes. In that case, you might try peeing every 15 minutes on a timer, regardless of whether or not you have an urge, in order to get your bladder accustomed to being able to tolerate that much stretch, all while implementing all of the other relevant bladder retraining strategies, especially proper behavior surrounding and toilet positioning during urination. Pee every 15 minutes for about a week, and then you use urge suppression techniques in order to increase that time interval to 20 minutes. And you practice peeing every 20 minutes for the next week. The week after that, you practice every 25, then every 30 on up until you can tolerate anywhere from 2 to 3 hour intervals without having to urinate. However, as I said in the very first video in this series, I do not think that bladder retraining should be laser focused on replicating bladder norms. Instead, I think that bladder retraining should be focused on you feeling that you are in control over your bladder, instead of feeling like your bladder is in control over you. Again, I'm really not that concerned about whether or not you're peeing every 2 to 3 hours, so much as I want you to feel in control of and no longer distressed about your bladder. Finally, if none of these strategies are working well for you, I do want you to consider your bowel health. The rectum and bladder are actually very close together in the pelvis, and sometimes if someone has chronic constipation or chronic diarrhea, that can irritate the bladder over time, causing urgency frequency. And in those cases, that urgency frequency won't fully resolve until the bowel issues are resolved. All right, on that note, stay tuned for the final installation in this series, where we will discuss proper toilet positioning for urination. And thank you so much for watching. If you found this video helpful or enjoyed it, please do give it a thumbs up. And if you didn't like it, give it a thumbs down and let me know down below what I can do to improve my content in the future. Please feel free to comment absolutely anything, feedback, questions, content suggestions, anything. Sincerely, I do try really, really hard to read and respond to all of my comments. Don't forget to check me out on Instagram. And finally, if you want to see more content from me, please do consider subscribing to the channel. I make videos about pelvic things, like today's video, and I also make videos about life things. Thank you again so much for watching. I hope that you have a wonderful rest of your day, and I will see you in the next video. Bye.